So again, welcome to Patients Rising University and getting your treatments covered. I want to introduce the rest of our panel here. We have Carrie Rigo, who is a patient advocate. We have Samantha Smith, president of GPACT, and a very experienced chronic illness patient. And myself, I'm the Jim Sliney, Director of Patient Content here at Patients Rising. So let's dive right in. We're going to be talking about a few different topics today. We're going to break this into 5 modules. It's going to take about 35 minutes to go through it all. We're going to be looking at how to look at your insurance plan, how to document your condition, talking with your doctor, getting yourself ready for an appeal, and taking advantage of something called an unbiased review. Okay, so let's start with check your plan. Reading through your coverage is very important. It's not fun, but it is necessary. So I want to have Carrie talk a little bit, if you don't mind, what we want to look for when we're reading through our insurance plans.
Sure. So one of the things, and we'll talk a little bit more about how to get it, is you're going to want to look for whether what the restrictions are with respect to treatment. Particularly, a lot of the things that insurers will use is that something's experimental or investigational, and now their new favorite word, because there's nothing that defines it, is something can be unproven. And it's important to take a look at your plan for those specifics, and then cross-check that, because the particular insurer is going to have medical policies, medical guidance for certain trigger diseases and treatments. So it's interesting, there may be some conflicts. If your plan is self-funded, there may be differences, and also there may be state laws that allow broader coverage than whatever is in the plan or in the insurer's guidance with respect to that. We're also going to want to pay attention to requirements with respect to in-network, out-of-network services and how to get exceptions if you need to go see an out-of-network provider, and then also anything with respect to the appeals process.
Okay, thank you. That's there's a lot to look out for, apparently. How does one know, and either of you can answer this, how do you find out what your state regulations are, and so that you can hold your insurer's feet to the fire if they're not following them?
So usually the Department of Insurance in your state has a pretty decent consumer. It will either be, sometimes in California where I live, we have the Department of Insurance, and then we have the Department of Managed Care, which governs HMOs. So that's kind of challenging sometimes to figure out whether it's an HMO or a PPO. But usually there is consumer information with respect to what's available. I know the National Governors Association usually will put out information with respect to insurance regulation, but sometimes just a simple Google search of what the consumer protections are in your state will be helpful. And there's usually there's usually a hotline as well in most states where you can call up, and they answer pretty frequently and can give you some guidance about how to approach a coverage issue.
That's a really good point. So listeners out there, remember, the state's on your side. There are resources that you can tap into. And if you're not sure where to find them, you can always ask us for help, okay? Now we're going to talk about the importance of documenting your condition, because of course, insurers, anyone who's going to challenge you, is going to challenge you based on comparing the reality you present with the reality that's in your chart. And so we're going to talk a little bit about the letter of medical necessity, a very powerful tool for proving your needs as a patient. Sam, do you want to tell us a little bit about your experiences with letters of medical necessity?
Yes, and I will say that a letter of medical necessity with my doctor and from my doctor to insurance is usually the best way for me and has worked for me to get something covered when insurance is giving either me a hard time or they initially say no. So a letter of medical necessity is written by your doctor, and it tells what your condition is, and it's specific to you by your specific doctor. They'll talk about your diagnosis, the treatment that the doctor is prescribing, and why. And basically, they're writing a letter to the insurance company saying, this is what I believe as the doctor to this patient is going to work. Sometimes, I mean, in my own experience, that insurances kind of look at something as blanket treatments, or they say, well, this person got this treatment and it worked. Why are you requesting something different? If you're like me as a chronic illness patient, you don't fit the typical mold of what works and what doesn't. You kind of fall in that gray area. And that's where a letter of medical necessity can really help explain to your insurance company why your doctor wants to do something a certain way when it might be a little bit out of the norm. It might be a little bit more expensive or just a little bit different than what they generally cover or are willing to cover. And you can also search letter of medical necessity on the Patients Rising homepage if you want more information on that as well.
Thanks, Sam. Yeah, we're trying to put together some guides, a starting template, if you will, on where you can get started, the kinds of information you're going to need to get from your doctor to make sure that your letter of medical necessity, which is a legal document, by the way, is as powerful as it can possibly be. Now, it's important to review that document against your records, like Sam mentioned, because insurers are going to be looking very carefully for inconsistencies. Have you, Sam, won all of your battles, essentially, that you've used letters like this to wage against your insurance to make sure you got covered?
I actually have. What I've gone through with insurance, they tend to like to give me a hard time occasionally, or really all the time, about getting certain things covered. And the only reason I believe that I got covered was because we wrote a letter of medical necessity. My doctor would give me a copy. We would go over it together and say, this is what we want to present to insurance. This is what we have. And you put it against your records because, you know, if you don't keep good records, that's a good way for insurance to say, well, this doesn't match this. And if you're keeping the records, then you can say, well, this is why we asked for it this way. This is what I have. And it keeps you and your doctor on the same page. You guys are working as a team, and it really just, it helps kind of bring it down more from a doctor-patient perspective, and it kind of puts a face a little bit to what you're asking to be covered as a patient.
Okay. Yeah, there's a lot to review. And as a matter of fact, there are some other things that can help you strengthen your argument with your insurance company. Sorry, I don't mean to make it sound like it's contentious, but I think we all know it is a little bit. Carrie, can you tell us a little bit about the functional assessment?
Sure.
And
Sure.
how
I do
useful
want
it could be?
Absolutely. I do want to add something about the letter of medical necessity, though, and how we get to the functional assessment is oftentimes doctors and their staff are not good at drafting these letters, and they are more than welcome to take drafts. They love it when patients or advocates provide the drafts, even sometimes, you know, do the research of the journal articles, because they're not always keyed into your disease. You know your disease. And that's a much better way to do this sometimes than to rely on the doctor to do it as a team, as Sam says. The functional assessment is actually taking it to the next step, because sometimes when you're dealing with a coverage issue and they're saying that there's no impact on your activities of daily living, sometimes you need to go to an outside party and get further strength in order for that doctor to feel comfortable writing you a strong letter. For example, had situations where something they've said is not going to have an impact on someone's, you know, activities of daily living. That's a big thing with insurance, is if your medical condition is impacting your ability to do things on an active basis, then you're entitled to get coverage. So you may need to go seek out a special physical therapist or occupational therapist who can document that and then bring that back to your doctor and have them write a stronger letter. So that's what we mean by, doing some more functional analysis. What you're trying to do here is make sure that your doctor feels as comfortable as possible writing you the strongest letter possible.
Now, Carrie, if I wanted to get a functional assessment, would I ask my doctor to arrange that for me?
No, probably not. There are companies who do this nationally, who actually do functional assessments, occupational therapists, and typically it's interesting because they do them for disability cases where people need to prove to an employer that they're disabled, and they really have not been used for medical cases to show that treatments or things, show the patients where they are and how a treatment potentially could help. So there actually are a lot of companies out there. One of them is called Impact Medical, and they have locations all over the U.S. where you can have one of these functional assessments if you were needed to show your current state of physical condition and the fact that treatment would help you and how it's impacting your daily life. Like we do this a lot when someone will argue that something's cosmetic or even that the treatment is experimental, just to strengthen it in the fact and show that someone is in such a bad shape that they really do, need an intervention.
That's really interesting. I think because people might have a little trouble finding resources to get to a functional assessment, I think that's something, viewers, that we're going to add to the university so that you'll be able to follow links right from our page to get where you need to go. Now, there's a particular term, Carrie, called the standard of care, which seems to come up a lot in arguments with insurance. Can you tell us a little bit about why that phrase is so important?
Sure. One of the main things, obviously, we deal with insurance in denials is something being experimental, investigational, or this new term they love to use, which is unproven. So it's really important in the doctor's letter and in any arguments you make to say that this treatment is the standard of care. It's a little bit harder when you're dealing with cancer drugs because there's a bunch of compendium that you have to find. There's some very specific rules about what becomes the standard of care, but being able to support the fact that either in journal articles or in everyday practice, like lots of times with physicians, it's helpful for them to write, we've done this treatment hundreds of times, or this treatment is done thousands of times in the US. It's a common practice. So standard of care is an important term to use. I also use a lot of, the other term I like is medically necessary and standard of care. Those are kind of the two buzzwords of getting things covered.
Okay, that's really important to know. Now, involving your doctor in this process is not only vital, I mean, it's the doctor really who writes and signs off on the letter of medical necessity, but treating your doctor like a partner in this process is really important. So Sam, you've had a lot of experience with this. Tell us a little bit about the pros and cons of being open with your doctor.
I will definitely say that I think I'm very lucky with my doctors and the ones that have helped me get certain coverage. But it is really important. I can't stress it enough that because we worked together and we kind of both went head on at this problem, that's really the only reason that I got things covered. And the thing with their doctors is they're a little bit more familiar with the process. Like we as patients might be more familiar with the disease, but they're more familiar with this type of process. And they know you know you, and teaming up with them, they're your best ally in working with this. And I can just say from experience that I've had, as a type 1 diabetic, I've had problems with insurance and getting supplies covered, which seems really silly given that it's type 1 diabetes. I need insulin, I need needles, I need my pump, all of that. And insurance love to deny all of those things and tell me that I didn't need it. And because of my doctor and their office and the fact that we work together, we were able to get that covered. And it's been that way with the majority of my doctors and what I've gone through, and even getting maybe more experimental procedures covered that they generally don't want to cover because they don't know if it's going to work, and they don't want to pay for something if it's not going to work. Because of the relationship I had with my doctors and the open line of communication and really, really just pushing at it together, I really believe that's the only reason I've ever gotten anything covered, especially when they've denied it more than once.
Okay, it's really important for everyone to realize that having a combative relationship with your doctor never really works in your favor. I know that some patients with rare diseases, for instance, tend to fire their doctors when they're not getting what they need. But the key here is that the doctor, your doctor, is the gatekeeper for all of your health care. And without close cooperation with your doctor, you're not going to get what you need. So working together to build those arguments is very important. Now, what's going to happen is your insurance is, you're going to write a letter of medical necessity. You're going to.
Oh, Jim, this is Carrie. Can I just add one thing, though, about the doctor? Sure, I'd love to add it. I just want to add, for people who have HMOs, it could end up being a combative relationship with your doctor, and that's a whole different thing, because one of the challenges with HMOs is your doctor gets penalized for referring you for additional care, and I think you have to realize that. And although they may say things to you verbally, to put something in writing, especially with you going out of network, gets them in trouble. So when you're dealing with an HMO, you really have to take a different approach to getting the things that you need. And also, I think, realizing that not every doctor and staff is skilled at dealing with insurance. In fact, very few are. Probably more of the ones who do the battles often are. So in many cases, as a patient, it's helpful if you respectfully help them deal with the process also, because they're overwhelmed by this. It's the number one reason why doctors hate private practice and end up going to HMOs, is dealing with insurance. So kind of understanding their frustration too is a good way to look at this and trying to be more active. I think it's right with respect to Sam, when I see patients who don't get what they need, it's because they rely too much on that the doctor or the staff is going to do it, but they have so much to handle. It's very important to be proactive.
Yeah, it's interesting. I recently heard from a small panel of patients that when they ask their doctor to help prove their case for need, their medical necessity, the doctors will often charge them for the time that it takes to do the research and write the letter. That kind of blew my mind. I didn't see that coming. But I mean, it's a valuable chunk of a doctor's time. So anything that we can do as patients, and anything we at Patients Rising can do to lessen the burden on the doctor improves the patient's chance of success, I think.
Got it.
So talking about success, your insurer has the right to deny any requests you make. So you're going to need to prepare yourself for an appeal. Happens a lot. But appeals are often worth it. Samantha, have you had experience appealing denials from insurance?
I have. One of the worst things that has happened is when you are trying to fight for a specific insurance or specific treatment or medication, and you go to the mailbox and get a letter from your insurance and saying it's been denied. And usually in that letter, you will get something that says, if you want to appeal, this is the process. And sometimes when I've gotten a letter like that, it's really disheartening. It really, really sucks to get something that you were really hopeful for, because you probably feel terrible and just want to feel better. And this is maybe the medication or the treatment that can get you there. And appealing is stressful, and you shouldn't have to prove that you need something. But unfortunately, the way that it works, being a patient and insurance and having money involved, sometimes you do have to prove that you need something. And the biggest thing that I can stress about this is that even though it might feel hard, it might feel disheartening, you are 100% worth fighting for. And that chance for you to feel better, that is what you're fighting for, no matter how stressful it might be in that moment. Even if you want to break down because you're wondering why would they deny this and why are you dealing with more stress, you have to take that chance to flip that appeal, because if you don't take the chance and you just say, well, they're not going to pay for it, so why would I appeal it? Or they said no once, they're going to say no again. You might just be able to change their mind. And that's where having the letter of medical necessity, having your doctor on your team, and doing the research yourself, as we've been talking about, and being proactive, this is what that's preparing you for, is that appeal.
Yeah. Well, I mean, people of a certain age, I'm 52. I grew up, when I was younger, insurance was just a thing that was there. It was always there. You can pretty much count on it. You didn't have to do any fighting. You didn't have to make any phone calls. That's obviously changed. So I think all patients can benefit from becoming more proactive in their healthcare. Sitting back and letting it happen isn't a good strategy anymore. And as we can see on the slide here, appeals actually do pretty well, since insurers will sometimes deny something without putting much of an argument behind it because they figure people just aren't going to put up a fight. Well, if you put up a fight, your chance of getting what you need is not too bad.
Yeah, I know for myself that I think a couple times there, when you're getting that letter, like you said, they might just say no because it's an expensive treatment, it's an expensive medication, and if maybe it's a little bit off label, or maybe you haven't tried something else before you tried this, and all the rules and regulations that come with different parts of insurance and getting what you need, sometimes they do assume that you're not going to fight for it, so they do say no. But as I've learned, and I think as insurance has learned with me, when I've been put in that situation, I am the patient that's going to fight for it because I am worth fighting for. And that's the biggest thing that I think is important when working on these things, and following all the rules and reading the fine print of making sure that you do send that appeal in within the X amount of days that your insurance is requiring, and making sure that you're dotting all your I's and crossing all your T's, because you don't want to give them another reason to deny it or say no because of maybe something small, like you didn't fill out the paperwork and get it to them on time.
Yeah, excellent point. There's a process essentially to getting your appeal together. Carrie, can you talk about some of these steps and the importance of them?
Sure. But let me just add a couple other things to you about appeals. Sometimes an appeal is not necessary. I know it's overwhelming to people, but many times we've been able to get people covered by simply, getting your doctor and emailing the medical director. If it's a smaller plan, if it's a bigger plan, every state, for United, they'll have a regional medical director. Sometimes Medicare has medical directors for each state, each region. Sometimes you can get things done just with that, emailing the medical director and calling them. You don't necessarily have to go through the appeal process unless it's something that they really have an issue with. Usually involves more than one patient. So there might be a particular condition or drug that they have a problem with, or there's a policy against. So sometimes that can be handled that way. And if we look at getting the internal documents, one of the first things I sometimes request all the documents, because oftentimes in there, one of the big things is medical decisions are not always made by doctors. And sometimes you can get stuff showing that nurses made decisions, or people who don't even have a medical background make decisions. It's worth making the request, but sometimes they take really long to respond. So I don't always get all the documents. And sometimes, and I will say more often than not, they don't provide anything that's particularly helpful. You want all the denials. You want to look at their arguments. You want to look at their coverage policy. Another thing that's really important, like I mentioned before, is to compare that to your plan. Important in this argument is if you have a self-funded plan, like you have 70% of people, their employer has a self-funded plan. The employer actually, we talk about call the medical director. In some cases, people have called their employer and gotten things covered without having to go through the appeal process. The employer's plan and policies about coverage might differ from the insurer who doesn't want to cover a condition, but the employer understands that covering a patient will result, if they don't cover it, they don't get the treatment they need, they could end up disabled. And the point of having a self-funded plan is to make sure that people are covered. So you get all the documents, you review their documents, your plan, you prepare a counter argument. Oftentimes this involves going back to your doctor, one or more doctors to get more support. Unfortunately, sometimes requires with experimental treatment, you doing a little research yourself. NCBI, which is on a website, has all journal articles. It's very useful to search for journal articles looking at the society, whatever society of gastroenterologists or whatever your treatment is. Sometimes they have treatment protocols that you can find things on that support your argument. And then, going back to your doctor and showing them what they need. Again, kind of taking the approach, though, some doctors will file appeals for patients. I will say overall, unless they're doing it on a general basis, maybe for cancer patients, they don't do a great job. I was just working with Sloan Kettering. They have a huge department to help patients, and for a particular drug that a patient needed, it was on the edge and they didn't know how to make the argument, and the patient, they didn't do it. And we were able to get the patient covered with a couple phone calls. So don't rely on the doctor's office. Get their insights, but make sure you make your own arguments. When you file your appeal, make sure you do it with priority mail and that you get it recorded. If you have a self-funded employer, then I always recommend finding the rep for that employer, because they actually will walk it through the system for you and it won't get lost. Have a conference call with the rep for your self-funded employer and ask them, tell them about what's going on and have them involved in the process in filing an appeal.
Yeah, those reps are pretty experienced because they're dealing with other people with very similar plans. And Carrie, quick question. The process that you referred to before filing an appeal, where is that the peer-to-peer review?
Oh yeah, we didn't mention that. I don't think we had that in here. Yeah, usually there's a peer-to-peer done before the appeal. The first denial that comes through they'll be allowed to be a peer-to-peer. Sometimes the peer-to-peer works fantastically if your doctor's willing to do that, and he can convince the medical director to cover the services before you get the more formal denial that you'll need to appeal directly. And if I would say if there's an opportunity to do a peer-to-peer, just do the peer-to-peer, because probably in my experience, maybe a third to a half of things can get covered with just the peer-to-peer. And, in talking about the appeal process a little bit more, there's going to be, there's several levels of appeal. There'll be the peer-to-peer, there'll be an internal level appeal. There may be 1 or 2 levels of internal appeal. You might not want to do both because it takes 30 to 45 days for each. And then there'll be an opportunity for an external review. So depending on your state, the state actually may pick the external reviewer. Sometimes payers have contracts with external reviewers, and there's a whole strategy for making sure you get a good external review with respect to these services. You're going to have to demand, someone with that experience in that specialty. And in some cases, even when the external review comes back and it's not done well, sometimes you can get it redone.
Okay, there sure is a lot to know about making sure you get your treatments covered the way you need them to. Before we go any further, one of our viewers had a question about and this is from Wendy, how do I ensure that when my care is the best I can get when I have to get a new general practitioner? How do we know that they're going to essentially help us the way we need to be helped with a rare disease or a chronic illness? Any thoughts, any of you?
From my experience, I wish I had a really great answer to that, but from my experience, a lot of that's been trial and error. But when looking for a new PCP like that, I will generally ask somebody, a doctor, maybe another patient, somebody who is in the same chronic illness community, maybe if they've heard of that doctor, if they've helped, if that doctor has helped them, and the doctors in my life that I trust their judgment, I'll usually ask them for recommendations or their thoughts on that particular person.
Yeah, that's a great tip. That points at the importance of relying on your community. Patient support organizations can provide a lot of really helpful information, both what has been successful as far as making your argument for medical necessity, and just getting access to the resources that you need. If you take part in a patient support group, it's a good chance you'll be able to tap into some things that you wouldn't just know about if you were on your own. But we're going to move ahead a little bit here. Talk for just a second about when you are talking with your insurance, or anyone for that matter, anytime you're fighting for yourself, it's important to make sure you keep really good notes, because you're going to come back to those notes later. Who did you talk to? Get names. What did they say? Quote whenever you can. Make sure your dates and your phone numbers are accurate. And if there are any errors, or if they seem to not understand something, really make a good note of that, because it could be part of what's involved in the misunderstanding, which is leading to the problems with coverage. So always take good notes and hold everybody accountable who you're talking to. Now, when it comes to having your case reviewed, I know we're looping around a little bit here, you're going to want to know who the person is who did the review that led to the initial denial, what their specialty was, because they may not be specialized in your area of need. You don't want a podiatrist reviewing your neurology case, for instance. I don't know how often that happens, but you want to look out for things like that. What are their qualifications, and do they really understand your disease? So how can they speak to it? And now we're going to move on to the usefulness of unbiased reviews. We're reaching out to other people in this case. Carrie, you have anything you'd like to talk about here?
Sure, I alluded to this a little bit earlier about the process. So after you've gone through the external reviews, there's an internal reviews, there's an external review process by a third party. And usually on those cases, people can be successful. Like the state-run ones in California, 75% of people can win on external review. Sometimes it can be even higher. One of the useful things when you do these external reviews, especially if you're in a patient group, is to include other people's external reviews where they've had positive decisions, because you're trying to make sure the doctor who's not associated with this insurance company feels comfortable making the decision. Many of the states have an external review process. This only will apply though if your plan is not self-funded. If you have an employer self-funded plan, which is 70% of people, then the insurer is going to have a contract with a third-party review company. Doesn't necessarily mean you're going to get a worse external review, because in some cases dealing with the state structure when there's a problem with the review can be an extra layer. As I kind of alluded to before, sometimes when we have a poor external review, either because they picked the wrong type of doctor, the doctor just did a poor job. We've had some cases where the doctor has denied a procedure where he works for a health institution where they actually provide the procedure. You can go back and request a new review. So I think the thing with external reviews is always go ask for them, but also understand that if there's a problem, the fight's not done with respect to these things, especially if you're self-funded and you have an employer too, because sometimes we've had the employer get involved and ensure that the proper company is picked for this external review also. Investigate the company. They should be talking with you also. If you do an external review, the external review company should give you a call and make sure that your documents are there, because sometimes you can't rely on the insurance company to send over your review documents. And you also can kind of push them to make sure that it's done in a timely and appropriate basis.
Okay, there's a lot of accountability in there, so it requires being proactive for sure. Now, we've kind of covered most of what we needed to cover here. We're going to now just summarize everything, and then we'll look at some questions, okay? So you always want to read your insurance coverage. Be familiar with it. Look for those hot words that might cause you problems, like proven or experimental and such, in network, out of network. Watch for those restrictions. Make sure that when you need it, you get the letter of medical necessity. You may not need to even go as far as the letter. Maybe a peer-to-peer review will suffice. But whatever the case may be, make sure that your argument for medical necessity matches what your chart says, because that can be used against you. The functional assessment that Carrie talked about, finding out if this condition is impeding, or the lack of treatment rather, is impeding your ability to, say, work full-time or something to that effect. It could be a valuable tool. And making sure that, of course, the treatments that are being referred to as needed are part of the standard of care. That means working closely with your doctor. So make sure to treat your doctor like an ally, because your doctor really is your best ally in this process. And ask them questions if you have them. Don't be shy about asking your doctor questions. If you're going to have to make an appeal, we talked about several of the steps important to being prepared for that. We're going to have more of that information available on the Patients Rising University website that you can look at later on. Document everything as you go. Challenge the reviewer if they're not in the area of specialty that your disease is. And consider the value of getting an external review if it's needed. Okay, we covered a lot of ground today. I know there are a couple of outstanding questions, and so I'm going to put this to the panel. Michelle asks, do the same principles apply when an expensive drug is not on the formulary? Which is to say, can you make the argument for medical necessity if an insurer says that a drug is not on the formulary? Anyone on the panel got a thought on that?
First off, I would say the compendium are always changed. Make sure you've checked all the compendium with respect to the drugs in the formulary, because there may be support for that drug. In some of each insurer, they have various different compendiums. See if there is enough there to support the use of the drug. Also, some plans, especially self-funded plans, will have an exception, even if something is completely judged experimental investigational, if there's a potential for benefit. And sometimes there is a little exception there, especially with self-funded plans, that you can make an argument.
Potential for benefit, that sounds like an important phrase too. Now, any of the things that we talked about today, are any of these rules different if you happen to be a Medicare patient or a Medicaid patient?
I know from my experience that Medicare is very specific on their rules, and they can be very black and white, especially if you're a rare disease patient, because they might not be used to insuring or getting treatment and coverage for your specific rare disease, just because they don't see it very often. I can't necessarily talk about the ins and outs of it, but as someone who has Medicare and is a rare disease patient, that they try to fit sometimes a square into a circle hole, and that doesn't always work for you. So that's where I think, from my own experiences, working with your doctor and asking questions and seeing if you can get a representative either from the insurance company, from maybe somebody in a support group, like Carrie had spoken about, different groups out there that have advocates, people who understand the system better. That, I think, from my experience, would be your best bet in understanding and making sure that you're still able to get the coverage you need.
Okay. Another question coming in from Victoria. How can you tell if your insurance plan is self-funded?
Well, usually, sometimes you can look at your plan document and see that, but probably the easiest way is to call Human Resources and ask them.
Okay, that's fair. Yeah, get to know the folks in Human Resources when you can. They're also useful allies. Well, we've hit a little bit over 40 minutes, so I think we are going to pull the plug here, everyone. I want to thank Carrie Rigo and Samantha Smith for being a part of this panel. I think this was a great chat we had. And I want to tell all of our viewers that keep an eye out for a follow-up email to this webinar that will point you towards resources that you can find on Patients Rising University. Feel free to go there and explore. And I'm going to give a little plug as well to patientsrisingconcierge.org, our new patient navigator, to help you find services that you need in your local area. Okay, as always, Patients Rising is here for you. So if you ever have questions or concerns, don't hesitate to reach out to us. This is what we do. Thank you, everyone, and have a great day.